It's an ordinary day at a public health clinic in suburban Khartoum. But for a child, a visit here is anything but routine. And for babies like Halima, just 43 days old, it could make the difference between life and death. The injections and drops she's receiving will protect her against a range of deadly diseases. It's an insurance policy that mothers in wealthier countries might take for granted, but not here in Sudan.
أكيد لازم هي يعني تتحسن التحسين ضد أمراض كثيرة وهي مهمة جدا والحمد لله يعني الدولة قامت بمحاربة بالذات شلل الأطفال.
That's a conviction Salah Hussein would readily endorse. His job is to maintain the cold rooms where the Ministry of Health's vaccines are stored before being dispatched around the country. The vials must be kept chilled to exactly the right temperature, right up to the moment when they are dispensed to children or adults. Sudan's vaccine cold chain is one very tangible expression of UNICEF's partnership with the Ministry of Health. The procurement of equipment, the vaccines themselves, and the training of the staff all represent an investment in children's health and one which is reaping dividends.
If we look at the data from the household surveys in the year 2006 to 10, there is a reduction in the child mortality in Sudan, and I think UNICEF had a bigger role in this result or in this achievement. Hopefully we will continue in a better way so that we can achieve the MDG.
The challenges facing Sudan's efforts to reach its Millennium Goal targets become clearer in places like Darfur. Here on the western fringe of this vast country, the impact of poverty and conflict on children's well-being is stark. 1-year-old Yasmin first came to this UNICEF-supported feeding centre 3 months ago, severely malnourished and weakened by diarrhea and vomiting. Left untreated, she would surely have died.
This is the third visit. When she came first time, her weight is 4.6 kilograms. Now she is 5.5. That means she's improving. She's gaining weight.
Malnutrition is a long-time enemy of Sudan's youngest citizens. A third of children aged under 5 years, 1.5 million in all, are underweight or stunted or both. One response that is proving effective involves ready-to-use, high-protein therapeutic food. In Darfur alone, over 40,000 malnourished young children were treated in this way last year. But given the resources and better community involvement, the impact could be much greater.
To get into the villages, to screen children and identify them at an early stage so that they can come for treatment. I think that component will need to be strengthened.
Clean water, or the lack of it, is the other key determinant of a child's health here. Nationwide, just 60% of Sudanese have access to usable water. But there are wide disparities among regions and between urban and rural areas. In the IDP camps of Darfur, a changing climate and other factors make finding clean water a particular problem, one which falls overwhelmingly on girls and women. Even so, long-time camp residents like Kaltoum Daoud say the arduous task of bringing water for her family is a lot easier than it was. It used to be very difficult to get water, she says, but now I can bring it from the pump nearby. Giving community members themselves the responsibility for identifying their water needs and the skills for maintaining the equipment that delivers it is central to the strategy adopted by UNICEF and its WASH partners. The community role will also be critical as UNICEF's focus shifts to tackling the issue of sanitation. Currently, even basic latrines are not available to a full 3/4 of the population. Decent toilets are a prerequisite of the child-friendly schools now being built across the country with UNICEF's support. These improved structures are critical both to getting more children into school and to improving the quality of education that they receive there. Again, communities play their part, contributing their labor and much of the materials.
The environment of the school is good. When it is good, our students come to school. But when the environment is not good, that means the children not come to school.
Too often it's girls who are most likely to miss out on the opportunity of schooling, the result of deep-rooted cultural beliefs and practices such as early marriage. Challenging another long-standing and widespread tradition, that of female genital cutting, is the inspiration for the colourful Salima initiative. This brings together celebrities, religious leaders and the mass media in a bid to persuade communities and families that an uncut girl is healthy, or in Arabic, Salima. New mothers are a particular target of the campaign. Nurses are trained to address their concerns and encourage them to keep their newest family members uncut and healthy. Meanwhile, the need to strengthen the protective environment for children and young people drives a quite different program, one that helps children caught up in conflict gain access to education, vocational training and work. A year after the separation of the South, the Republic of Sudan is grappling with multiple challenges. In order to tackle them effectively, this complex and diverse country needs to harness the potential of the youngsters, who make up fully 1/2 of its population. By meeting the different needs in health, education, water and protection of this younger generation, the prospects for Sudan will be enhanced, its future more readily secured. It's an objective to which UNICEF, working alongside its many partners in government and beyond, remains as committed as ever.